Good morning again, everyone. We will get started in 1 minute at 10:34. All right. Good morning, everybody. Thank you so much for joining us. My name is Erin Scott, and I am the Executive Director of the Family Violence Law Center located in Oakland and serving all of Alameda County. And I'm going to just briefly let you know who's joining us today, our panelists, and then we are going to get right into it and start our discussion. So we have with us Dr. Sarai Crane, Deputy Chief of the Department of Violence Prevention at the City of Oakland, Courtney Ruby, who is the auditor for the City of Oakland, Carrie Abbott, Director for the Office of Homeless Care and Coordination for Alameda County, Tunisia Owens, who's the Policy and Advocacy Manager at Family Violence Law Center, and not officially on our panel, but also joining us, in case you're wondering who the other square is there, is Nashi Gunasekera, who is our housing and gender justice advocate at Family Violence Law Center, an integral part of our team. Before I get into questions, I want to just talk a little bit about our title. So our title is Conversation on Domestic Violence and Homelessness. But we're going to talk about a little more than domestic violence. And the umbrella term I'm going to use is gender-based violence, which includes domestic violence, dating violence, sexual assault, stalking, sex trafficking. And the reason that we use the term gender-based violence as the umbrella is because these issues disproportionately impact women and female-identified people, and because the root cause of this violence is misogyny. So even though more people than just women and female-identified folks sometimes are victimized by these types of violence, and also the impact, of course, is broader than just the people who are directly victimized. But it's important from the perspective, at least of Family Violence Law Center, that we don't forget the misogynistic roots of these forms of violence. So just want to presence that for everyone today. And like I said, we're going to get right into it. We will have, I'm going to ask some questions of our panelists. We're going to have a little bit of discussion. There will be time for you all to ask questions as well. So if you could put your questions into the Q&A instead of the chat. But if you forget, we'll try to monitor both. And I believe we're going to have some help from Dina Shoup from the City Auditor's Office in terms of monitoring those questions. So thank you, Dina. So Courtney, my first question is for you. In your role as City Auditor, which is an elected position, how can you have a positive impact, and how can you and your office have a positive impact on homelessness, particularly women's homelessness? Oh, Courtney, you're muted.
Oh, how many times that's been said to me. Thank you, Erin, for the invitation to be here. And I'm honored to be here with Sarai and Carrie and Tanisha and Nashi and yourself and the community to have this important conversation. And I'm going to talk a little bit about myself, and then we'll jump into it and what my office does. So as Erin said, I'm the elected city auditor. What that means is that I am the watchdog in the city of Oakland. I am the eyes and ears of the residents and the community to hold government accountable. And in doing that, my team and I look at what are the most troubling spots in government. We are a small team, we're 10, including myself. that we go in and we analyze these hotspot areas. When this is my third term, I served 2 consecutive terms, took a 4-year break, and came back when residents requested me to run again. So from doing that, I came back into a situation where we could, the residents were telling us this is a crisis point, what's going on in homelessness, what's going on in the encampments, what is the city doing? President Boss was in on having the encampment management team come in and talk to her during council meetings. So I reached out to her to say, this is one of my top issues, let's work together. And so in the spring, we issued an audit on encampment management services and interventions. And in doing that, we identified deficiencies in the city's approach to that. We identified, I'll give you one example because this is not the purpose of today's time together, but $12.6 million was being spent on encampment management services, and the city was unaware that it was spending that. So my team and I had to roll up our sleeves and calculate how much the city was spending on the encampment management team, which is a collection of city departments that are responsible for implementing the encampment management policy. When we issued that audit, we received a letter from the Family Violence Law Center to say, I don't think you've considered everything here. We really appreciate the work that you do in oversight, and as an advocacy organization and from the policy department, there's some pieces here missing. And if you are to represent all people, and if you are to make the impact that you desire to make, let us work together. So I just want to acknowledge, Aaron, Tanisha, and Nashi for reaching out to us and having that conversation, because it's an opportunity to educate us. One of our commitments during this audit was to be very comprehensive, to look across the city and identify impacts. So then it was clear from in looking at this and having the conversation of what is the gender analysis when it comes to homelessness in the city of Oakland? And are we truly equipped to address homelessness in women? So as we had this conversation and they were able to educate us, we have our next audit that we're working on, which we will encapsulate. And this will look at the disparities in service. So we will drill down on that data to identify, is the city addressing women in homeless as in the ways that would be most effective to them. The first audit touched on outreach, and outreach is a part of it. You have to know who your people are. You have to know the lived experience in order to be able to affect the services. So that is how I came to be here today. I'm incredibly grateful for the Family Violence Law Center and our collaboration. And it is my hope that in this collaboration, we inspire others to come together to make sure that we are uncovering these systemic issues to make sure that all residents are served.
Thank you, Courtney. Carrie, in your current role, just a tiny role as Director of Homeless Care and Coordination for the county, how do you think your office can improve the ways that we address homelessness amongst gender-based violence survivors?
Thanks, Erin. So I work with the county's Office of Homeless Care and Coordination. It's a relatively new office, established just almost 2 years ago, and it's within the Healthcare Services Agency. So I had been in place for just a few months when the pandemic began. And of course, this represented a whole new level of emergency for people fleeing violence and for people experiencing homelessness. Our office worked with the gender-based violence provider community to set up one of the non-congregate shelters, one of the hotel shelters, to be a safe place where people could come from congregate settings. A lot of our domestic violence shelters are congregate shelters. And so it was really an urgent need to have a place where some people could go to decompress the congregate shelters. And then in addition to one of the hotels we set up that was specifically for women and families, we also set up a scattered site program so that people who needed anonymity could have hotel stays with their provider, providing services, but not in the large non-congregate shelters that were set up for the homeless population generally. So through that, we were able to assist about 150 households who were fleeing violence, who were in the scattered site program. And we know that it was an even more urgent need, especially during the initial phases of lockdown, where people could end up feeling really trapped in really untenable situations. Right now, since the pandemic response is ongoing but changing, as we were discussing earlier, right now we're working on a program called emergency housing vouchers. And these are vouchers set aside by HUD specifically for people experiencing homelessness to be administered through coordinated entry. So while the housing authorities hold the vouchers and are our partners in this, our coordinated entry system administered by the county is referring people to the housing sites and working with people on applications. And in Alameda County, because of the number of people we have fleeing violence, we arranged with our providers and the housing authorities a set aside of 10% of those vouchers just for people fleeing violence, fleeing domestic violence and sexual assault and trafficking. And so that equates to, it'll end up being between 85 and 90 vouchers that can be used in permanent housing. So it'll provide that ongoing economic assistance for people who are fleeing violence, so that it's not the 6 month Band-Aid, if you will, of what some temporary assistance programs. It's really intended for the people who could end up chronically homeless after needing to flee an unsafe situation. So we're just really happy to be able to provide that new intervention. We know that in Alameda County, 10% of people who become homeless have fled violence directly. They were fleeing violence when they lost their housing, and that's a really, really high number. We know that in Alameda County, over a third of our homeless population in general is identifies as female. And that means that, around 2,500 people on any given night are female and homeless in this county. So really a tremendous level of need. 10% again of those were actively fleeing violence, but 25% of the people in our homeless population have said that they have experienced gender-based violence. So really a tremendous need. And what our office is doing with our provider network right now is mostly focused on the people who do not have the resources to find new housing right away on their own and be able to sustain that economically. And, in particular, people who may have serious mental illnesses or other disabilities that may keep them from being able to reestablish themselves in this rental market. So looking for subsidies, looking for services that we can provide to people and that can be ongoing as people stabilize into housing. And so we just this week have proposed a new HUD-funded coordinated entry system with multiple access points throughout the county that people fleeing violence could access. And we're very hopeful that that will be a successful application so that we will have a coordinated entry system that is really responsive to people fleeing violence, that maintains confidentiality and attaches really needed and appropriate services. Thank you.
Thank you, Carrie. There's a lot going on, and I want to specifically just call out the work of Building Futures, one of our sister agencies that works on domestic violence issues, but also has been addressing housing and homelessness issues for decades. That they've been a huge partner with us and with Carrie and also the larger network of gender-based violence providers that have been moving these efforts forward at the county level. So Sarai, you're a deputy chief of an Oakland City department that's focused on violence prevention. So how do you see homelessness being related to the mission of your office?
Oh, well, first of all, good morning to you, Erin, and to all of my fellow panelists. I'm so grateful for the invitation. I am not excited to talk about gender-based violence just because of the nature of it, but I am passionate about discussing these issues because I feel like it's education everywhere, and it's still one of those things that. Did I mute myself?
You did.
Okay. I thought I was on a roll. Let me answer the question then. So to answer the question that you specifically asked, again, my thanks given to everyone at VLC, and tremendous respect for you. In terms of the Department of Violence Prevention, and I'll just speak specifically for my role, well, the department was established with 5 mandates, 2 of them being to address gender-based violence, specifically sexual exploitation and intimate partner violence. And so built in, the actual fabric and value of the department itself is looking at gender-based violence, which is unprecedented. The city has never been specific in making sure that there was a mandate to address gender-based violence in that way. I think one of the things that's happening currently that we're seeing, and that we've seen a real surge in the last few years, even pre-COVID, but definitely throughout COVID, is the surge in violence against individuals that are female and female identified in some of the encampments that have been around the city. And so on one end, we know that houselessness is its own vulnerability, or creates its own vulnerability for gender-based violence, specifically sexual exploitation, and some forms of sex work, but sexual exploitation in particular. So there is definitely a link and a vulnerability for individuals that have become unhoused and do not have housing security to experience intimate partner violence, sexual exploitation, and sexual assault. So the other rising of these types of clients or victims has become highly problematic, and it's really useless because there's so much of the experiences that folks have, at the intersections of being, housing insecure, actively houseless, and or being exploited. We also know in the county of Alameda that gender-based violence is one of the leading causes of housing insecurity for folks who, are female and female identified. And so I think that, from our office's perspective, one of the things that's been really, I would say, overwhelming, but also exciting, is making connections with other departments that have been siloed in the past. And so my specific role was designed to address the strategic implementation of programs, outreach policy that would address gender-based violence. So that was, the way that the position was even designed. Which has given a unique entree to be able to, say to someone in another department formally, hey, we need to be having some conversations about the ways that we're working collaboratively, because far too long, it's one thing within the ecosystem of violence prevention, gender-based violence, have been we've been the little bastards of the movement. It's been gun violence and homicides without addressing gender-based violence as homicide and violence and shooting with injury. And so really making those connections, but also looking into other spaces. I'm thinking of one of the coordinators from the Human Services Department that works specifically for the unhoused population prior to I forgot the actual position description, but there was someone designated through the city administrator's office to address homelessness in the city of Oakland. And he's ended up leaving, but before that, we connected to be, it's like, well, how can we start this conversation? And now LaTonda Simmons, who's in the city administrator's office, is still moving and working forward with that kind of leadership. And so having not only those conversations, but thinking strategically about the ways that we need to be collaborating on ways of addressing it. And I think with the unhoused population, we're just finding that, individuals that are experiencing that, many of them, some will disclose their experiences. You have to be gentle about approaching it, because sometimes, with victims and survivors, they don't lead first with their victimization. they'll leave first with the issue of, not having the housing security or maybe needing medical intervention. And then after some screening and intake. So beyond just identifying victim services, but looking at the caretakers that are engaging with folks so that they're knowing to screen for and keep their eyes open for potential violence that they may be experiencing in their families within the context of their intimate relationships, and especially for trafficking and exploitation. So I'll park there, but I will say prior to coming to the city, when I was executive director at Baywar, one of the things that we saw during COVID, because I was doing that work at the same time, was the tremendous vulnerability that was increased for some of our sexually exploited minors in particular, who had the comfort of being able to couch surf and to find safe shelter, even if it was at a family's house for a week or two. Once COVID-19 hit, those options were either eliminated or severely and significantly decreased. And so that just, continued to spin the cycle of vulnerability and actual violence that they were engaging in, because many were just trying to survive. So it's been really difficult to try to get a handle and a grasp on it. I think housing insecurity, specifically in a region as expensive as Alameda County and Oakland in particular, it's no longer this profile that we had of individuals that were, homeless, or, housing insecure. That profile has shifted. So it's no longer, people that were habitually substance users, habitually, some of the problematic tropes and racist tropes that we've developed to, have this picture or image of individuals that are dealing with that. But now it's expanded to folks that, look like me oftentimes. And so it feels overwhelming, and it also feels exciting to create more pathways for us to be working together in unity to try to address some of this stuff. So I'll park there for now.
Thank you, Sarai. So Tunisia, I'm going to ask you a question that I'd like to also open up to everyone else after you respond. So there's a lot of good work, I think, happening, but from the descriptions that you all have provided of things your office is working on. But what do you see as the gaps in how our community understands women's homelessness? Because I think some of the projects you all have described and the issues you all have described that we're trying to tackle in part stem from gaps in people's knowledge or understanding about women's homelessness. So Tunisia, if you could take a first attempt at that question, and then I'd like to open it up to get everyone else's perspective.
Absolutely. Thank you for asking that question, Erin. And I know you're being humble, but I was actually hired at FVLC to come and work on this issue specifically, that intersection of gender-based violence and homelessness, and really to highlight what's working in our system for survivors of gender-based violence, and then where there are areas for growth. And that project, the HUD DV bonus, allowed me access to Carrie Abbott and to all of the meetings that we have around coordinated entry, which is all of the homeless providers coming together to meet and talk about these different things that are going on. What are the trends? How do we respond to it? How do we get these databases working in a way that is efficient and effective? How do we track people who are by definition mobile and untrackable? And so this has been really exciting work that Janae before Nashi and I have been working on. And so some of those gaps, I think, that I've seen in my work starts with how we define homelessness. So who is homeless? And one of the things, just as Sarai mentioned when she was talking, when you have someone who is couch surfing, or someone who can afford to stay in a motel for some days of the month, or live with family for some days of the month, those people are not literally homeless. And so sometimes are not captured in our system in the ways that when we're providing services. And so I think when we start to look at that definition, HUD has a specific definition because of the resources that they're sending out, but we have a bigger mandate. We have to serve our community. And so those folks who are couch surfing need services. So expanding that definition of homelessness is one way. I think, and connected to that is the invisibility of women's homelessness. Because living on the street is so unsafe for women and female identified people, that is a last resort. And that's what makes it invisible. The women who are on the street are visible, and that's what's making it such a big issue, is because you're walking out of your door, you're driving past the encampments and the tents. But when you're talking about someone who is doubled up, or someone who's employed but doesn't make enough money to pay for market-based rent, and there aren't enough affordable housing units, then they become really vulnerable and they are invisible, those women. The other thing I'd really like to point out is that women have been hit the hardest by COVID. Those stats, that data is apparent, and it is regularly reported that women have been hit hardest by COVID, and the job employment situation has been very harsh for women. Another thing, another gap, I think, is a focus on prevention. So preventing someone from falling into homelessness. And one way that the FELC addresses that is through Housing First, which was a demonstration project initially a couple of years ago, but now we're seeing the results that it is much better to try and prevent someone from falling into homelessness. And so offering them supportive services in addition to financial resources to get on their feet, to stabilize themselves a little bit, to get that extra helping hand so they don't fall into homelessness, because it is a much bigger lift to get yourself housed once you have become homeless or once you've been evicted and all of those things. So I think that the prevention side of this is really important. And I know that Carrie, in the 5-year homelessness plan, we have definitely talked about that as a goal for Alameda County. I would say that data and appropriate technology for survivors is another important piece. We know that there's a big gap in data collection and knowing who is homeless for exactly those reasons. They're mobile, and with survivors, we know that VAWA, the Violence Against Women Act, prevents us from putting them into databases, and so it's a little harder to collect that information. We know with trafficking survivors, again, that's another area where it's very hard to collect data to know exactly who and how many people are being trafficked and exploited. And then I think that supportive services is another gap that's missing. We know that there aren't enough affordable housing units, but also because the federal poverty line is so low and the Bay Area is so expensive, there is this really big gap between people who may be employed, but still are just at the edge, and they're just one paycheck away or one emergency away from falling into homelessness. And so expanding some of these resources, childcare, universal basic income, some of those things I think are really important to think about addressing women's homelessness. And I'll stop there. I could say a million more things.
Yeah, before I hand that off to someone else, I do just, think sometimes people aren't necessarily aware that some of the funding sources that fund supportive services are actually tied to that federal poverty level, where, not all funding sources, but some of them require you to only serve people who fall under that federal poverty level, which does exclude a lot of people who cannot otherwise afford assistance. And then there's one other thing you said, Tunisia, that I want to highlight, and then I'll hand it over. But the disproportionate impact of COVID, economic impact of COVID on women was even more disproportionate if you look intersectionally at gender and race. So just, want to lift that up as well. And that's not because of COVID, that's because of structural inequities, in our society, but also, so just want to lift up when we're talking about women as a group, that's also not a monolithic group, that people living at the intersections of multiple identities, maybe experiencing multiple levels of oppression that and inequity that lead to even more disproportionate outcomes. But yeah, I would love to hear, Courtney, great. I would love to hear from others about this issue of what are the gaps in how our community understands women's homelessness, or anything else you want to pick up on from this discussion.
Yeah, thank you. And Tanisha, thank you for going over the gaps. And and again, that's where our conversation started with the Family Violence Law Center, was to look at these gaps. And I think that, our job as auditors is to analyze the problem. However, if we set the framework up incorrectly or not expansively enough, then we are in tunnel vision when we're analyzing the problem. And I think that government is highly complex, and that there has been an approach. So I've worked with HUD for years and years because I used to run the Episcopal Charities Service Center. And we worked with homeless organizations and applied for funding and did all that. And, it was this approach that you fill out the boxes. And we are living in a world, and government has a responsibility to live outside of those boxes, and I think that when we come in and we look at the structural inequities, so we as auditors, or any of us that are tackling these hard issues, needs to say, what are the systemic issues, and are we asking the right questions? Because I think we're looking at those systemic issues, but if we're not looking at it from a lived experience, there is no way that we can bring the solutions to the table. And I also think it's we've talked about resources and nimbleness, that you have this limited pot of money. So we're using this pot of money, and the truth be told is it, if we ask the right questions, this was like the county just did the racial equity analysis on homelessness, right? Saying that if we apply the money in the right way, we can actually have impact within 5 years. But we have got to have that analysis on the front end. And it is the same with gender-based violence and homelessness. So, and the part that for our team, is like, it's right in front of us, and yet they're not being counted. These women are not being counted. They're not being seen in this way, in a systemic way. And so that's where we have to step back and redefine our process to say, how do we capture that? How do we bring recommendations to the table that will uncover that, so that government is focused in the right place to then solve that issues.
Carrie, Sarai, do either of you have thoughts?
I did want to, it's so true, because we just did all of this work around racial equity and homelessness. And it is so hard right now to have aggregate data on women fleeing violence experiencing homelessness, because we are keeping all of that information confidential and within each organization. And so that is actually one of the proposals that we put into HUD for this new coordinated entry system for people fleeing violence, is to be able to set up data systems so that we can get that kind of analysis, so that we can have a much better understanding of who's fleeing violence within our system and ending up experiencing homelessness. And so I just, really just to completely underline and agree with that it's really frustrating, because I think we know anecdotally and from agency to agency that it's overwhelmingly African-American families who are ending up homeless after fleeing violence. And we need to be able to hold that and to show that and to tailor our response to those inequities.
The one thing I wanted to add too, because I 100% agree, and I think that it's it's difficult to really wrap our minds around the full scope of the issue if we're only looking at, the data that's available, because it's, sketchy at best, only because it is hard to, grasp and capture not just the racial identity and how folks identify there, but also where their, gender expression and or orientation and or identity lie. So when you're talking about, the unique vulnerabilities of queer and trans folks, I understand that for teens, that being queer or trans is one of the number one risk factors for them being vulnerable to being unhoused and homeless. So when you're talking about folks that are sitting at the intersections of, being queer, trans, and or gender non-conforming or expansive, as well as, of another maybe marginalized ethnic community, and having survived gender-based violence, it's just so overwhelming and enormous. I think, I'm thinking of, a colleague who has been doing work with youth who have been experiencing sexual exploitation. And she said, without reservation, that at least, 90% of the individuals that have come into the shelter where she's, providing leadership, that at least 90% of the ones that are queer and trans have been trafficked and or being actively trafficked. And so there's just so many layers of the crises. And yeah, I think those of us who do the work, we just know these statistics. And so when we see things that are published, we kind of apply our own understanding to create more of a sense of urgency. But I feel like if there was, much like what Tanisha was saying, like just the education, just folks, just even knowing, I feel like that would prompt a bit more action from multiple spaces, either policy or advocacy or some, and all the spaces in between where we are challenged to address and intervene in some of this stuff. So I just wanted to name that as well.
Let's talk about that sense of urgency, because yes, we do have particularly strict confidentiality laws that we need to follow when we're serving survivors. And yes, there are other reasons why it's difficult to gather that information, reluctance sometimes on the part of people we're working with to disclose or share. However, I would say that, we've all heard the phrase, a budget is a value document, right? And so I would also just say that as a community, and we're not alone in this, we have not really dedicated resources to fixing those data problems, because they are fixable. They're difficult, but they're fixable. So, I think that's just one example of, a demonstration of a lack of urgency around this issue. So what do you think we need in this community to generate more of a sense of urgency, or to prioritize these issues more than they already are being prioritized?
So I always say, and I'll just, this is just kind of macro level, I feel like leadership really matters. And when we have folks who are visible in positions of leadership, be it in government spaces or in, agency community spaces, activism, and in whatever spaces, sports, whatever is influential, if they're not an ally or advocating or even stating it, it's not going to, right? So it's not going to prompt the sense of urgency. And so that's where I'm seeing, some of the critical gaps in just our understanding and why it's not a big problem. I am shocked at how regularly my experience is of having conversations about the prevalence of gender-based violence, and folks are just so shocked. And I'm like, how are you shocked? So I have to recognize my own location and be patient with the lack of information. Because of course, when you've been immersed in this work, it's so common sense to us. And there's a gap between us who know and are informed and have, all of the statistics and the data and all of the, all of the stories and the testimonies and the experiences of people in our hearts. We have all that, we hold it. It's what drives us to do the work that we do. from the individuals that are just completely disconnected, and they think they're disconnected. And when they learn how close the problem or the issue is to them, then it becomes a sense of urgency. So typically it's general kind of organizational psychology. If you're, if you have close proximity to a, particular community situation, experience, trauma, whatever it is, it matters a little more to you. And so unfortunately, I feel like folks that, are in positions of influence and leadership, it's not a big deal until it's in their family, in their households. And so, I have been heartened by more of the spotlight being on gender-based violence, I'll say, over the last year in particular with, I'm thinking of the Reimagine Public Safety efforts. I'm thinking of just robust community activism from the gender-based violence community and just making their voices known and heard, even though I know some of you, even like I'm thinking of you, Aaron, years ago being at, council meetings or being in, committee meetings or commission meetings and, being maybe one of 3 people trying to raise the issue. And now there is a bit more attention on it, but it took a little bit of not just the nudges didn't work. It took some public scrutiny, to say it mildly, to really raise the issue. And unfortunately, that's what it took to get the attention. So I'll park that there, but I just wanted to start answering your question from that in terms of the sense of urgency. The problem is it just hasn't been there because I feel like for folks where it counted and who had the influence, it just hadn't hit them. So.
Yeah, Tunisia, did you raise a hand?
Yes,
Yeah.
I was just going to say that I think part of this urgency challenge is exactly what Sarai said. The pervasiveness of gender-based violence is so real to us. And I don't think we don't always talk about it in that way. And I think that, yes, it's important to pull on people's heartstrings, but as a math geek, I also think it's important to talk about the costs associated with this. So when we look at ACEs, the adverse childhood experiences, and understand public health, and then we start to think about what are the costs that the community has to absorb that the state is paying in multiple visits to emergency rooms, in the health consequences associated with witnessing gender-based violence in your family, experiencing it, then that's where it starts to make sense. I think the budget is a moral document. And if we start looking at prevention in that way and connecting this as a public health issue, then the urgency becomes clear because there's such a high cost. And we can see that with the growth in the homeless population and the unhoused population in our community. Those costs are so high because when it becomes chronic, then there are a host of other issues that you have to layer into the issue that if we had prevented would have cost so much less. And so I'll just stop there.
Yeah, Courtney?
I agree wholeheartedly. And I think it's this equity piece. I mean, when we talk about the leadership, right? We shouldn't have to tug on leadership when the information is clear and the data is there. And again, it's that the budget is a moral document, but it's equity in funding, it's equity in outcomes, and that's where we see government turning, right? And what Carrie talked about, this racial equity analysis that's done, and hopefully HUD will fund the gender analysis to understand that government has a responsibility to take care of everyone. And if we equate the dollars, right? But we've said this conversation in every avenue. It's the same with kids, right? We know that if we provided more support with our kids, that they would be better educated and there would be less outcomes that they would have to determine, that there would be less choices being made that would cost society more, right? So there's this piece where we have got to be realistic that we created the problem, right? So we come back to the responsibility piece. We created this and now we must fix this. And I think that that's where the piece that I am hopeful because of the conversations in equity, that we will address this from that standpoint. You know, one of my notes said it's that, you know, well, this is a smaller piece of the puzzle. We have to take care of all this other stuff. You know, so even if you look at the homeless population, right, and one of the things is that they look at males in homelessness, because it's easier to see that, it's easier to understand that at some level, right? But that's not equitable. You know, you're not trying hard enough. And I think that, again, that goes to that leadership piece. We have to take out the influence and replace it with equity.
Carrie, was there anything you wanted to add? Yeah.
Yeah, I just wanted to add, you know, I completely agree with the budgeting and making sure that government and leaders are accountable. And I think that, you know, I think that we can see that it's in reach right now. And that's a really exciting moment. But I also think that it takes something more than that. I think it also takes this tenacity and creativity, because I mean, Courtney, you started out talking about the boxes and checking the boxes, and it is so true that, like, so often we don't see what we need in the multiple choice, and we have to then create new boxes. We have to create new choices. You know, we run into barriers all the time in trying to solve these problems, especially intersectional problems. You know, where you know, we'll hear, oh, you can't do that because of fair housing, or you can't do that because of coordinated entry regulations. And usually those are unintended consequences of good intentions, right? And so you have to be able to figure out how to question those boxes and how to get people outside of them. You know, when I was in San Francisco, we needed to have supportive housing that was just for women, and to be really clear, including trans women, because that is a really important inclusion. And, you know, I just think we don't say it enough, but there needed to be safe, supportive housing for women. And what we heard was, you know, oh, you can't do that because of fair housing, or oh, you can't do that because of visitor ordinances, and, you know, and we can create legislation if we need to. It's not always necessary, but we can create new programs that don't fall 100% into domestic violence programming and don't fall 100% into homelessness traditional programming, that fall into assisting people who are fleeing violence, who have nowhere else to go. And they don't have to look exactly like the programs that used to exist in one system or still exist in another system.
So I have another question for you all, but before we go there, I actually did want to see, there's been some activity in the Q&A. Thank you to Nashi and Carrie for answering some of those questions. And then there's, I see in the chat, a lovely acknowledgement from Trisina. Thank you. Thank you for your thanks. But I just wanted to see if there was anyone else who had questions for our panelists before I move on to the next question. I don't want to put the Q&A piece just shoved right at the end of the hour. So, and does anyone have questions? And I think, let me see. Yes, I think if you just say that you have a question in the chat or in the Q&A, that we can allow you to speak. So I'll give people a minute to do that, make sure I'm monitoring that. While we're waiting to see if anyone has questions, you know, this is for everybody. Is there something about gender-based violence that you recently learned that you feel like people should know about? You know, Sarai, I don't know if there's anything, there's always something new to learn, right? But I'm thinking more of, you know, probably of Carrie and Courtney with this question, but I also don't want you not to chime in.
I'll let them take a stab first, and then I'll.
Yeah, so yeah, anything you've learned that you feel like people should understand or should know about?
Well, I feel like I already spoiled mine with the 25% figure, but that is astounding. That 25% of our homeless population has experienced domestic violence of some sort. It's astounding and just unacceptable. But I had not realized until recently how very high that was.
I think for me, it is the, again, I just want to take ownership from, the auditor's role, to really drive down on the subpopulations, the data, to look harder in identifying these disparities. So I am grateful again for the collaboration, that you all came forward, Erin, to say, this is an area you need to consider, because I think that's that part of government where people think, we're not necessarily doing what we should be doing. And yet it is the advocacy, it is the power in the education where we can take this and then highlight it. So I'm just grateful for all that we are learning right now, and then how we are incorporating it into our work.
Well, thank you, Courtney, for your openness and generous listening. That's not always our experience when we approach government officials. And really, all the credit goes to Tunisia and Nashi. They jumped right on that and and followed through. So we have a wonderful team. Tunisia, is there anything you have learned that you think people should know more about? And then Sarai, you also can answer that.
Yes, I think one of the things that I learned in doing this work is that the community funds crisis support services a lot more for survivors, because you think about, oh my God, someone in the hospital, or they're trying to flee, they're leaving. But if you think about someone leaving and starting over their entire life, what level of support that needs, and you can't cap it at a month or 3 weeks or 6 months, because someone is starting over. If you're able to leave with any documents, with any clothing, you might have 2 or 3 days, maybe up to a week. And if you have children, how many bags can you pack? And so the idea that it's just about the shelters, or it's just about, a couple of motel nights, it's not that. It's so much deeper. And so it's much more long lasting, that we need to provide support. So that's something that became clear to me when I took the DV 101 course. It just never occurred. I thought about shelters and crisis support, but not that long-term support.
That's good. I think this, I will offer it as something that I've learned. And I think one of the things that I've learned and realized painfully is that really discourse around homicide and loss of life is what drives public policy and public safety discourse. And I think when we're, having kind of large scale conversations around public safety, that's what we focus on. And the reality is there's more to the equation around public safety, particularly as it pertains to women and girls and queer and trans folks, than homicide. It is happening, and I think what people don't understand, especially in the city of Oakland, I'll just talk for the city of Oakland, that the sharpest increase in shooting with injury, assaults, and homicides over the last 15 months, particularly the last really 8 to 18 months, has been women and female identified victims. And it's something that's not getting the same kind of attention, but it's not just Black and brown boys in East and West Oakland. These are women and girls who are being shot at alarming rates. I just got a notification about a shooting of a female identified victim that walked into Highland this morning. My colleagues at a place like Highland are saying this is the worst they've ever seen it. They've never seen as many women and female identified folks being treated for injuries and homicide. And so I think that again, to the point that I made earlier, that so much violence is gender-based violence. It just doesn't get categorized that way. And I wish that much like what, Tanisha is saying, that the supportive services that should be available to an individual besides bedside advocacy, besides, them getting help, filling out Cal VCB documents. But when you're starting over, either with trying to rebuild a life and having a home and shelter, or rebuilding from a place of extreme trauma and terror in a place that used to be safe to you, and needing to relocate as a result of some traumatic experiences in that way, is overwhelming. And I think that the conversation just needs to go beyond crisis line calls, which are critical, which I believe in, which we need to, still, be doing that as a form of outreach and as a form of intervention, but also looking at how intervention needs to be a part of prevention, not just from gun violence, but also in areas where folks are experiencing harm at the hand of someone that is known to them, or someone who has just decided to perpetrate whatever forms of violence based in what you said, Erin, misogyny, and just toxic, very, very toxic notions of how women and female identified folk need to be treated. So I'm looking at the time, so I will wrap it up there.
And I'm going to actually take moderator's prerogative and answer this question myself to close us out. I think something I've learned over 30 years working on these issues is that in general in this country, and definitely at the local level, people working on gender-based violence issues are often the only ones who are looking at gender inequity as an issue on a regular basis. So when we're talking about gender inequity more broadly than just gender-based violence, if not us, then who? So, this is, I think, has become part of our work at Family Violence Law Center, really trying to expand the conversation. We're not just talking about incidents of dating violence, domestic violence. We're talking about a much broader inequity issue that unless we talk about it that way, the violence isn't going to stop. So I really want to thank you all for participating. Thank you to our attendees. We have recorded this session, so we can send this recording out to the attendees and obviously the panelists, and please feel free to share it widely. This conversation is very important. So thank you all for participating, and I hope you all have good weekends.
Thanks. It's such an honor to participate with this group.
Absolutely. Thank you all.
Thank you, everyone.
Thank you.